Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Dixon's Chemist, who are the experts in LDN and associated treatments in the UK. Dixon's Chemist are the most cost-effective for LDN in all forms within the UK and Europe, maintaining safety standards far in excess of what is required. Why would you choose to get your LDN from anywhere else? Call 0141 404 6545 today to speak to their LDN experts. Today I'm joined by Dr. Pamela Smith, who is an MD from Michigan. Now, Pamela has written 10 books and she has just released the 10th book, and the 11th book is going to be coming out next year. Thank you for joining us today, Pamela, and could you tell us about your new book that has just come out?
Absolutely, and thank you so much for inviting me on the program. My new book is called What You Must Know About Vitamins, Minerals, Herbs, and More. And it really is an anthology of looking at all of these kind of nutrients. And the whole idea is choosing the right nutrients that are right for you.
Mm-hmm. And
So we have different sections of the book. We have, vitamins as the first part of the book. So we do look at vitamins A, D, E, K, etc. We have a section on minerals, one on fatty acids, one on amino acids. We have section number 5, which is on herbal therapies. Section 6 of the book, I lovingly call other nutrients because it covers things like phosphatidylcholine, coenzyme Q10, alpha-lipoic acid, probiotics, and other things that really don't fall into a traditional category. And then part 2 of the book is on health concerns, meaning we actually go through different disease processes like hypothyroidism, low thyroid function, hair loss, insomnia, dry eyes, all these different things, and we make suggestions from the medical literature on which nutrients work better for those clinical conditions.
Mm-hmm. So do you test people of their minerals and vitamin levels, or do you increase those vitamins anyway for certain conditions? How does it work?
Well, basically, that's an excellent question. You can do many things. You can measure 28 vitamins in someone's body. There's a test called micronutrient testing available worldwide, where literally you can measure all of those levels. You can go by age, as long as people have normal kidney and liver function. For example, starting at the age of 50, most people make less of some of their fueling sources. They make less coenzyme Q10, less lipoic acid, etc. Mm-hmm. So you can make some generalities as well.
Okay. So once you decide which path you're going to take to treat a patient, what is the next step? Do you titrate them up, or do you work out what would be the appropriate dose?
Well, my favorite way is obviously to measure. I'm a physician, I'm a scientist, we like measuring people. Mm-hmm. So, for example, if you measure vitamin D is a fat-soluble vitamin. That one should always be measured because vitamin D you can get toxic in. So we try and measure that, but we want the patient to have optimal levels and not just normal. Vitamin D is so, so, so important. But the question is, what does perfect mean? And so when you look at vitamin D in American units, which are what are used most commonly internationally, when you look at vitamin D, you want the level to be 55 to 80. 44 is normal, but it's not optimal. So you want that patient literally to have perfect levels, because then vitamin D decreases the risk of developing breast cancer, colon cancer, Parkinson's, MS, diabetes, high blood pressure, and really a number of different disease processes if you get the right amount of vitamin D. I mean, we can go through and talk about each vitamin. It is so important to have vitamin K. Vitamin K is adequate bone mineralization, so you don't get bone loss. It's very important for heart health. It's very important for blood clotting. And so there's each different nutrient plays a very important role in the body.
Mm-hmm. You mentioned probiotics. Now, I've had so many doctors tell me that when I've asked, what are the top 4 nutrients, vitamin supplements that you would always rate highly, and probiotics is usually maybe number 1. In your book, you said that you're talking about probiotics. It's a bit of a nightmare, isn't it? When I was looking to find out, which was the best for your money, because you can pay a ridiculously high amount of money for a very good brand where you may be paying for the name as well. But how do you assess, when you are looking to buy a probiotic, which is the best one that you should be taking? How do you navigate your way around that one?
Well, that's an extremely astute question, because, first of all, new literature is showing that for most people, not all, but the general population, we probably should rotate probiotics, meaning that they shouldn't take them all the time, the same one. Mm-hmm. So for most people, take one really good one for 6 months, then the next 6 months alternate into another one, unless your doctor has particularly prescribed a probiotic for you. Mm-hmm. Otherwise, for the general population, it's good to rotate them. Most of the really good probiotics do require refrigeration, and so we do keep them in the fridge. I usually like to take my probiotics separately, so they're not taken with other things, because sometimes nutrients interfere with it. So it's nice just to take them by themselves.
Okay. I didn't know that. And how do you go by the different strains? What is it we should be looking for?
Well, you want a good general probiotic so that it carries a number of different things. And you also want something that's what's called pharmaceutical grade. Mm-hmm. Nutrients come in different grades. And pharmaceutical grade means 2 things. Number 1, it means that it's bioavailable, meaning it gets into the body and does what it's supposed to do. And it also, pharmaceutical grade, means that it's guaranteed to be 100% pure with outside verification. And when you look at the idea of probiotics, you want a good mixed probiotic for overall health, because probiotics improve digestion. They help the immune system function well. Your gut, your GI tract, 70% of the immune system is right in the gut. So the gut has to have that good bacteria. And also, people don't think about it, but probiotics help manufacture biotin, folic acid, and niacin so that they're all in the right amounts. So if you ask me, are there 3 things I suggest for every single patient in the world? There are. Anybody who's an adult. Mm-hmm. 1, a probiotic.
Mm-hmm.
2, a multivitamin, and then 3, it may be somewhat variable with people, and depending on where they live, most people do need additional vitamin D unless they're out sunbathing.
Mm.
Okay,
Yes.
but the third one that everybody else needs otherwise is omega-3 fatty acids, otherwise known as fish oil. Most people don't get enough omega-3s, so I do take 2 fish oil tablets a day, every day, because I don't eat fish every day.
Mm-hmm.
So it gives you really good fats.
And there are so many people, patients that I speak to, who will tell me that they have a very good balanced diet, they don't need to supplement it at all. But as you were saying, that once you reach 50, your body is lacking in certain vitamins, minerals, supplements. And is this something that you discuss in the book?
Absolutely. It is something I discuss in the book. We look at things on what happens with age. Absolutely. There's also interesting things that happen when you combine food with medications. For example, grapefruit. I discuss this in the book. Grapefruit increases caffeine levels. And so some people, if they eat grapefruit and they drink a cup of coffee, they're going to get nervous. Grapefruit also can increase the levels of different medicines, like warfarin, which is a blood thinner. In fact, there's even a trial showing that grapefruit can cause hives if taken with naproxen, which is a non-steroidal drug. So, interestingly, even foods can have an effect on what happens in the body. Mm-hmm. And we do discuss all this in the book. There's a whole chapter looking at mixing supplements, drugs, and foods.
Mm-hmm. Well, I was mixing my probiotic with yogurt. Is that allowed or not? Or should I be taking it in water?
It's best to take probiotics by themselves.
Mm-hmm.
You
Okay.
get a much better.
Yeah. Well, that's interesting. Very interesting. So what else do we learn in the book?
Well, in the book, you're probably going to be surprised to realize that most people cannot eat their way into health. Believe it or not, in today's world, because things get genetically engineered and we don't always replenish the ground with nutrients, almost everybody does need to take at least a multivitamin. People tend to be surprised about that. Mm-hmm. Other things that people tend to be surprised about, and they look at the book, but there's actually many medical trials showing that if you look under health conditions, there's studies showing ways that we can all look at things to prevent cancer. There's studies showing that chlorella, taking a teaspoon a day, decreases the risk of developing cancer. Not eating a lot of sugar decreases the risk of developing cancer. Eating too much bad fats and salt, just some common sense things. And then again, a lot of it depends on what you're interested in. So, for example, if you're interested in prevention of cataracts, then believe it or not, there's medical trials showing that alpha-lipoic acid, B vitamins, bilberry, carnosine, which is an amino acid, lutein, N-acetylcysteine, glutathione, your basic vitamins, selenium, those things help prevent cataracts. So a lot of it is prevention as well. It's always best to prevent the disease.
Oh, absolutely. You mentioned my multivitamins there. And again, it's a bit like the probiotics. There are millions of different multivitamins. You know, where do you start? What is a good multivitamin? What should you be looking for?
You always want to look for pharmaceutical grade and a broad spectrum. Mm-hmm. And those are the two things you look for. And the trouble is that you usually, if you're in my age group and you're over 60, you usually end up with a multivitamin where you have to take a number of them. It's not like when you're 20 and you may just take 2 multivitamins in a day, that's enough. I really do have to take a number of them because you want to prevent disease and treat things. Mm-hmm. So I have high triglycerides. So I personally take omega-3 fatty acids, which many studies have shown help lower triglycerides, and I take phosphatidylcholine, which studies have shown help lower triglycerides. So, my goal is that I may still have a heart attack because I inherited high triglycerides from my dad, but I'd like to be 95 when I have that heart attack and not my current age of 64.
Mm-hmm. Wow.
It's also important to have nutrients to keep the body going well. So, for example, the thyroid gland has to have enough iodine. So if you never, ever, ever, ever eat any fish, then you probably want to see your healthcare provider, have your iodine levels measured, and see if you need iodine if you're not eating your way into it.
Mm-hmm. Oh, that's interesting.
I think a fascinating one in the book has to do with high cholesterol. Everybody thinks, high cholesterol is, I ate too much this, that, and the other. Of course it can be. But people don't realize that high cholesterol can be due to biotin deficiency. Biotin is made in your gut. Mm-hmm. So if you've got reflux, IBS, GERD, all those things, your gut's not healthy, you're not going to make enough biotin. You have to have carnitine. You have to have some of these nutrients in order to lower cholesterol, including vitamin C. Mm. So there's, nutritional things that are important for the body that I think sometimes people don't realize. So that's part of the reason why I wrote the book. Mm. I want people to have a good idea of vitamins, minerals, herbs, and more of a personalized approach to them. And it's called A Concise Guide to Better Health and Longevity. And that's what we want people to be as healthy as they can be.
Mm-hmm. Well, that's interesting that you talked about high cholesterol. I suffered for many years with acid reflux. My mother had a heart attack in 2000, Christmas 1999, just before the new year. And she had what they called hereditary high cholesterol. And they wanted to check me and my 2 daughters. My cholesterol level was so high that I could have had a heart attack or a stroke at any time. My eldest daughter, her cholesterol level was fine, and my youngest one was borderline. So they put me on a statin, and I had to see a consultant. And I said to her, I'd rather really not take anything. Can I, alter my diet? Is there something I can do so I don't have to take this statin? And she said, if you were to live on a glass of water and a lettuce leaf, you would still have high cholesterol. So
exactly. If you've inherited that pattern, that is very correct.
Is it? Okay. So could I still... I altered my diet. I have to say, listening to Dr. Tom O'Brien, I'd stopped eating gluten, and literally in days of stopping the gluten, the acid reflux stopped, and I was able to stop taking the anti-acid tablets. So that was amazing. So that's not a problem. But would I still be able to reduce that level of cholesterol naturally? Or, even if I have
Absolutely.
to still take the statin, I don't care, but I would like to try and bring it down. So, because the doctor had said to me, as I get older, I might have to increase the amount of statin I take. And if I can do something now, and I'm 62, I may not have to take a higher dose. Do you see what I'm trying to say? I can accept.
I do. I absolutely see what you're saying.
Hereditary.
Because side effects are dose dependent. Yeah. I'm not anti-statin drugs. The goal is that you take the right dose of statin drug.
Mm-hmm.
And so side effects do go up with any drug,
Yeah.
the higher the dose you take.
Mm-hmm.
So number one, anybody taking a statin drug, they get deplete in the important nutrient coenzyme Q10. So they need coenzyme Q10 if you're on a statin drug. So for you, for example, you're over the age of 50,
Mm-hmm.
so you need 100 milligrams of Q10 because you're over the age of 50, and another 100 because of the statin drug.
Okay.
Are there other ways that can lower cholesterol? Oh, there's pages and pages in my book.
Mm-hmm.
My personal favorite is berberine. I absolutely love berberine. Berberine, 200 milligrams twice a day is a great place to start. You can go all the way up to 500 milligrams 3 times a day. Very effective to lower cholesterol. Even coenzyme Q10, Google lipid. People may not be familiar with that one. It's GUGULIPID. 50 milligrams twice a day lowers cholesterol. Polycosanol works very well. For those out there, if you haven't heard of that one, it's POLICOSANOL. 20 milligrams once a day or 10 milligrams twice a day. Another one of my favorites is tocotrienols. Just how it sounds, tocotrienols is a special kind of vitamin E, 400 to 800 international units a day. Very good to lower cholesterol. So all of these can be very effective, and most of them do mix with a statin drug. Not all, but many of them do.
Mm-hmm. Well, it's like a foreign language. I haven't heard of these. Do you have to take all of those, or just one, or a combination?
For most people, I suggest starting, like for you, for example, you're on the statin drug, make sure you're on the Q10, start a little berberine, 200 milligrams twice a day. As long as you have normal kidney and liver function, that would be great.
Mm-hmm. Okay. Well, this is really educational, isn't it? And it's all in the book. So people who are listening to this can follow your recommendations, and I'm sure they would get a really good idea of the guidelines of what you're suggesting now.
Absolutely. Absolutely. They'll have all of this in the book and more. I mean, we didn't talk about amino acids. The body produces amino acids. You eat your way into some of the amino acids. They're very important for memory and energy. So, yes, we hope everybody picks up a copy of What You Must Know About Vitamins, Minerals, Herbs, and More, because there's a lot in here, and it's written in bullet-style format so that it's easy to read.
Mm-hmm. Well, that's good, because if you see chapters and chapters of text, it's hard going, isn't it? But you can pick it up and put it down easily if it's in bullet points, and it's easier to remember, I think, as well.
I do too. I think people learn in bullet style format now because of computer systems. Mm-hmm. So it does make it easier.
Yeah. Now, as we said, this will be the 10th book you've written. What other books have you written? What have they been about?
Well, I've written 2 books on hormones. My most recent is What You Must Know About Female Hormones, or Women's Hormones. What You Must Know About Women's Hormones. Has been very, very popular. Probably my most popular book is What You Must Know About Memory Loss and How You Can Stop It.
Mm. And of course, you're going to be a speaker at the 2019 conference in June, so we'll actually get to meet you, so that's really exciting.
I'm very excited myself. I cannot wait.
So all the things that you talk about in the book, do they complement LDN?
Oh, they do. They absolutely do. I have the world's best editor. She is so fabulous, and she makes sure that they all complement each other.
Mm-hmm. Oh, that's wonderful. And where can people buy your book?
People can buy my book at almost any major bookstore. You can order online from Amazon or any major outlet online worldwide.
Mm-hmm. And do you have a website?
Actually, the website for this is going to be changed as the book is coming out because they're updating it. So that part I'm not going to give to you because that one would be difficult. But if people can't find my book, they can always email me at faafm63@yahoo.com, and we can give you that new website as it comes up next week.
Fantastic. Well, absolutely amazing talking to you. But if patients want to see you, do you have a website for that?
Yes, people can absolutely come to see myself or any of my partners. And probably the easiest way of accessing that is to literally call as opposed to get on the website. Mm-hmm. But we are, if you want to be on the website and look at us, we are the Center for Personalized Medicine. So if you type that in, then everything will come up if you're going to go on the web.
Mm-hmm. And what numbers should they call if they would like to make an appointment?
If they'd like to make an appointment, 313-886-4060.
Mm-hmm. And are you, not just yourself, but your partners in the clinic there, do you have a long waiting list? Do people have to wait to see you?
Well, our goal is there's not. I do have 4 partners, so I'm very blessed to have great partners. They're all fellowship trained in metabolic and anti-aging and functional medicine. So they've all done an entire fellowship. So we hope that people will be happy seeing any of us. So we try for there not to be a long wait.
Mm-hmm. Well, thank you very much for joining us today and speaking about your fantastic new book. I mean, I've made so many notes here. I'll certainly be getting a copy and checking it out.
Well, good. I hope you enjoy it, and I hope everybody in the audience enjoys it as well. It truly was a labor of love, but I'm very happy with how it turned out.
Oh, fantastic. And just before we go, you said there was another book going to come out. What is that one going to be about?
Yes, that one is scheduled to come out November 2019, and it's called What You Must Know About Autoimmune Diseases. Believe it or not, there's 105 autoimmune diseases. Certainly all of them are not going to be covered in the book, but the major ones are. There's more and more to know about autoimmune. So yes, that will be November 2019, What You Must Know About Autoimmune Diseases.
Well, we'll have to have you back talking about that because obviously LDN works amazingly for autoimmune diseases. Not saying it works for everybody, but it does seem to work really well. So that would be a really interesting topic as well.
Oh, I would be honored to do that, truly. There's 3 things that I do for every single patient with an autoimmune disease. And one of those is to put them on low-dose Naltrexone LDN. Mm-hmm. There's not a single patient in my personal practice with any of the autoimmune diseases that is not on LDN.
The million-dollar question that people will ask is, how long would I have to take LDN before I noticed an improvement? What would your answer to that be?
30 to 90 days.
Wow. That's amazing. It's a short period of time, really, isn't it?
It is a short period of time. In the scope of life,
yes,
it is a short period of time.
Oh, it's amazing. Well, we have to go. We've come to the end, but thank you very much for being with us today, Dr. Pamela Smith, and we'll have you back again.
Well, thank you so much. Everybody have a great day. You as well. Have a happy rest of everything, because I just love this time of year. As spring is about to blossom, it's such a happy time.
Thank you.
Thank you. Bye-bye now.
This show is sponsored by Dixon's Chemist, who are the experts in LDN and associated treatments in the UK. Dixon's Chemists are the most cost-effective for LDN in all forms within the UK and Europe, maintaining safety standards far in excess of what is required. Why would you choose to get your LDN from anywhere else? Call 0141 404 6545 today to speak to their LDN experts. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.